Yes, yes. We are live. We are live today. Today, you need it for your NCLEX. You need to master select all that apply to be able to ace those questions on your NCLEX. So stay right here with me. Do not go anywhere. Okay, so let's start right away. So we need to master select all that apply questions for the NCLEX. Okay, so let's dive into a quick introduction. So what is select all that apply? SATA, select all that apply questions. For the NCLEX, you're going to meet different kinds of questions, and one of them will be select all that apply. And there are multiple response questions where more than one option will be correct. So you have some single answer, best answer questions, but for select all that apply, you are required to select more than one option. So which means that you have more than one correct answers. So the purpose is that NCLEX wants to test you whether you can really apply your clinical judgment to complex real life scenarios. And NCLEX wants to test whether you are a safe nurse. So those questions will be testing you whether you can really are safe from unsafe actions. And then you should be able to recognize some patterns in the assessment findings that may be provided, and you should be able to intervene as and when needed, and then do the necessary teaching. So select all that apply will be testing more than memorization. Okay, the reasoning your clinical reasoning will be tested. So how will it be like? So the format, you would have a given stem for the question, and there will be a list of options. We'll be looking at examples very soon. And sometimes you may have even more. Maybe you have A to E options, but you can have even more. And you're supposed to check all the correct answers, okay? And there may be 2, 3, 4, or even all of the options may be correct. So you have to watch out. So the scoring system, we have a new scoring system for the next gen NCLEX. Initially, it was all or none. So if all or nothing, so either you get all the correct answers and you get a point, or if you get some wrong, then you do not get any mark. But upon revision for the next gen NCLEX, they now use the partial credit system. So you earn points for each correct option that you select. So if you select an incorrect option, yeah, you get no point. If you do not answer it, you get no point. So if you have options and you select, you have 4 correct, and then you pick 3, you get 1 wrong, you get the 3 that you picked correctly. Okay, so it used to be all or none, all or nothing, but now I think the partial credit system for next gen really helps. But you still have to be cautious as you choose, okay? So students used to struggle with this because of the fear of all or nothing. Because if in case I get 1 wrong, I'm not going to get any mark for that question. But now the next gen has given some modification, which is quite good, that it gives you partial credit for what you were able to pick. And a lot of candidates overthink because they do not want to get some of them wrong. So they overthink and they end up picking even the expected findings, which should not be picked, or even comfort only actions instead of really solving what the client's problem is. And candidates struggle as well because they do not treat each option as independent. So we'll be going through that as we look at our examples. You have to take option under that question independently and answer whether it's true or false. And that helps you to answer the questions correctly. So the key insight here is that select all that apply is a way for NCLEX to check how you're really thinking. Your clinical judgment will be tested with these kind of questions. So you should be able to identify everything that is correct, everything that is safe, everything that is evidence-based for your clients. And you should be able to know what is not needed, okay? So when you are going to select all that apply, number one, look for keywords. Read the stem carefully and look for keywords. Keywords such as priority, immediate, appropriate, and safe, or expected. If you say this is an expected finding, look out for all the keywords. They will guide you and clarify, is it asking for findings? Am I being asked to look for findings, interventions, or teachings, or precautions? Pay attention to what the question is asking. Number two, apply the NCLEX core priorities. Remember, we looked at prioritization last week. ABCs should always be on your mind. Airway, breathing, circulation, apply that. Always remember safety first before comfort. Always address unsafe conditions before pain. And remember this in prioritization, acute before chronic. So if you see keywords like new is a new issue that has cropped up, sudden onset, unstable. If you see unstable in your question, it comes before a client with an old diagnosis. And then look out for expected, or even if the client is stable, that should guide you as to who to see first. And then actual problems come before you address potential problems. We dealt with that last week. Address the actual problem first before potential problems. And then expected versus unexpected. If we expect that this client is taking this medication and is going to have maybe constipation as a side effect, it's expected. But if we have some adverse side effects showing up, we need to address the adverse side effect first before we address the expected side effect, okay? So always look out for what is expected and then what is out of the blue, what is unexpected. That should be a red flag and that should guide you. Number three, we have to treat each option separately, independently. So you read the option and ask yourself, is this true or false? And then you answer, would I do this for this patient in this scenario? Yes or no? And that should guide you to be able to go through the various options for every step. And then number four, watch out for these traps and distractions. You see, never should not distract you. Only some of these options may be wrong. And then comfort only interventions when safety is at risk. Look out for that. And then chronic or expected findings. You have a client maybe with asthma or COPD, and the client has barrel chest clubbing, which is expected in that chronic respiratory condition. The client with chronic pain. So watch out for these. And then watch out for delegation traps. When you have questions around delegation for select all that apply, know who can do what, okay? And always remember this. I think we looked at this some time back. UAP cannot assess, they cannot teach, they cannot handle unstable cases. So that should guide you in any question around delegation. And then, yes, we talked about the scoring system, which has changed for next gen, that now is the partial credit instead of the all or nothing previously. So I'll keep stressing on this. If you want to make it and pass your NCLEX, you need to master these three. Do not leave anything out. Master your mindset, what you are thinking about the exam. I think NCLEX is too difficult. Many people do not pass, and work on your mindset. If you are going to start the journey with a defeated mindset, then you have already defeated yourself. You're already defeated before you start. Master that positive mindset, knowing that yes, many have failed You may even have failed the first time, but hey, you're going to put everything together. You're going to do all the preparation, and then you're going to go again and you will make it. That gives you a boost. It powers you even in your preparations, because a defeated mindset is like a flat tire. It's already deflated and it cannot move anywhere. So why are you already defeated and you're forcing to study, you're forcing to join groups and learn? Power your mindset so that it will fuel you, because the journey will get tough sometimes and you need to keep going, keep fueling and keep running till you win the race. So master your mindset. So that's why here we do not just give you content, we also focus on helping you to be in the right frame of mind, which powers you to succeed. And number two, you have to master content. See for select all that applies. See all that you would have to go through. You see the STEM, you have to go through all the options and assess as to whether it is safe for your client or not. So it's not even about what you have memorized, it's about understanding. So if you do not understand the content, then these kind of questions will expose you, because NCLEX wants to be sure that you are safe. Okay. And then you master strategy. You can have all the content, but if you do not master strategy, test taking tips like what we are doing today, you know it, but you cannot apply it when you see the questions, and you will not be able to choose the right answers, and it's not going to end well. So master your mindset, master your content, and master your strategy. So that is why we focus on all these, to give you all that you need so that you are fully prepared. You do not have any deficiency in any of these arms. You are fully prepared to go for the NCLEX. So we are diving into these questions to really master select all that apply. That from today, you will meet select all that apply questions and you will just smile saying that, hey, I've got you. I will be able to get all the right answers. So let's dive right in. We are starting with this question, cardiovascular question. All the topics we are reviewing today under select all that apply, they are high yield. Do well to review them inside out. You must know them. So question one, and we're going to go through the steps, how you can ace these questions. So one, which intervention should the nurse implement for a patient with suspected myocardial infarction? Select all that apply. So step one, when you see the question, read the STEM very well and identify the keywords. Which intervention should the nurse implement for a patient with suspected myocardial infarction? Immediately you see select all that apply, you know that, okay, there might be more than one correct answer. So you are being asked interventions that you're going to implement. And then the case here is suspected myocardial infarction. So even before you see the options, what you're going to do is that you read it, you read it again, look out for the keywords and ask yourself, what does this question require of me? So this question requires interventions. So just think through quickly, what do we do for clients with suspected MI? What interventions? And if you've mastered your content, that's when it will click that, okay, Mona, if you know Mona, morphine, oxygen, nitrate, and then your aspirin. So do not forget this. So before you even get into the answers, you should know that for this kind of question, I should have Mona or my fingertips. So which intervention should the nurse implement? So this is an action or intervention. So you think ABC, MI, this is circulatory problem, and then you remember your mood. And as I said, your next step is that you're going to treat every option independently. So that's why I have put the options behind. So we're going to look at it independently. So in this question, I have this client who has suspected MI. And now I have remembered my content that Mona applies here. So now I scan through the options. Administer oxygen. Will it be needed here? Yes, of course. So I'm going to go through this and look at the next one, and you can choose your answers. Yes, of course. I need oxygen. Mona, O. Place patient in high Fowler position. Yes, I may need to do some positioning, but is it high Fowler? Then you think through it. Start cardiac monitoring. Do I need it here? D. Give nitroglycerin if ordered. Remember, Mona, the O, the N, yes. So remember that. Nitrates. And then encourage ambulation to reduce anxiety. Do I need that here? Is it a priority? No, no, no. So we have to take that out. So we have A, C, and D as our options. Morphine, oxygen, nitrates, and aspirin. So we're going to do A, administer oxygen, start your cardiac monitoring. It's so needed in MI, and then we give nitroglycerin. So oxygen is part of MONA. The positioning, mostly semi-Fowler, will help with the perfusion. So the high Fowler is not a priority now. Cardiac monitoring will help us, and then nitroglycerin will help relieve the pain. Ambulation is a no, no, no. If you're saying the client should walk around, you are increasing the cardiac workload. It is unsafe. So you do not have to choose this. If you choose this, you are not a safe nurse. So that's what select all that apply will be tested. So always remember MONA, morphine, oxygen, nitrate, aspirin. And we need to monitor the rhythm during the ECG. So no ambulation. Great. So that is how you go about your select all that apply question. Okay. Go through them. Is it a yes? Will I give oxygen? Yes, I'm going to give oxygen. Cardiac monitoring? Yes. Nitroglycerin? Yes. Ambulation? Do I need this? High Fowler. Not really part of what I'm supposed to do. Well, to be semi-Fowler, it would be okay. So, okay, high Fowler is not a priority. No. So you have to go through every option independently and choose your correct answer. Are we all good? Let me get your yes, yes, yes in the chat box, and let's move on to the next question. Great, great, great. Yes, yes, because I want us to take our time, because from today, I don't want you to miss any select or that apply question. So get ready to answer this as I go through it. We're going through it systematically, just as I taught you. So, which findings in a stroke patient are priority to report immediately? So start thinking through. All right, I have this client with stroke on the ward. What will really be a priority in a stroke patient? What are the problems of the stroke patient? Think through it. Think through it. What are some of the problems of a stroke patient? So you have to think through it. And then even before you run through the question, and then look out for the keywords. Findings in a stroke patient, priority is the keyword. And then it's saying that you have to report immediately. So there may be some of the options that look correct, but are you supposed to report that immediately? So always go back to the question and ask what is being asked here. Don't set your own, do not set your own kind of question. Look at the question and answer what you have been asked to do. Nothing else. Okay, so priority, and then so step one. So is it a new versus chronic? And then every option, take it as individual option and then answer true or false, yes or no. Okay, so in this case, findings in a stroke patient, what is a priority to report? So let's look at the options. Sudden difficulty speaking. Facial droop on the right side. So true or false? So sudden speaking, difficulty speaking, true or false? It is a priority to report immediately. Facial droop on the right side. Blood pressure, which is 160/90. New confusion. So look out for the keywords. New confusion and agitation. And E, chronic left-sided weakness. So let's get your answers in the chat box. What will you go for? Which of these would you do? So go through it one after the other and answer yes or no for each of them. And that helps you to choose the correct answers. Remember, it should be about prioritization. What really has to be done? So, okay, so Darling wants to do ABC, ABC and E, ABC and E. Ooh, remember the keywords. Anytime you see that something is new and has cropped up, that should catch your attention. But you did not choose D. D, you must choose D as well. And when you have chronic should not be prioritized. Remember, I looked at prioritization. Yes, it's important. It's good we have that finding, but when you have chronic attached to it, that is not going to kill your patient right now. So what will be a priority to report immediately? It is about what will harm your patient in this very moment. The chronic left-sided weakness will not harm the client. So let's go and help you out. So it's A, B, and D. A, B, and D. If all of a sudden the client is not talking, maybe the stroke is extending, there's a new extension. If all of a sudden there is a new facial droop, this is an acute neurological deficit. And then the mild hypertension is common in a lot of stroke patients post-stroke because it helps to maintain the perfusion to the brain. New confusion, when you see keywords like new, you have to attend to it. It means that the stroke may be worsening. So why is that your client was doing well, all of a sudden your client is confused? You have to watch out for that symptom. And then chronic weakness is expected in that client with stroke. So we are not, it's important, but we are not going to prioritize that. So please watch out for this. New neurological changes should be a red flag. Look out for what is chronic, what is already expected, and that is not going to kill your client. Because select all that apply is testing whether you can really prioritize and you can really analyze everything that you study, testing your clinical judgment, how you can see the cue, pick up the cue, analyze it, and then solve the problem. Okay, so you take the stem, ask yourself, is it expected or not expected? So sudden aphasia, yeah, it's new, it's a red flag. Facial droop is new, is a red flag. 160/90 hypertension post-stroke is kind of expected, so not urgent. New confusion, yes, I have to attend to it. Chronic weakness is expected, it's not urgent. Great. So let's see if we can apply what we've learned again. We are moving to COPD. All the topics today are high yield. We have studied them inside out. So, which findings indicate urgent intervention? Select all that apply. In a client with COPD exacerbation. So, you must know what COPD is all about. You know that it's a chronic obstructive pulmonary disease and consisting of emphysema and bronchitis. And when you see these images, you know that yes, the lung is diseased. So if you have a client with diseased lung, what will you be expecting? There will be shortness of breath, you have coughing, you have chest tightness, you have wheezing. So this should help you know what the problems of this client will be. So that should guide you to the next step. You are being asked which findings will indicate urgent intervention. So you start thinking about it. Look at the keywords, urgent intervention. So ask yourself, for this option, will I need urgent intervention? For every option, you have to ask yourself. And you know that if a client has COPD, what will be some of the problems? They'll be having respiratory issues, okay? So look out for the options that will be compromising their respiration. And remember, ABC, airway, asepticality, even before you go through your options. So let's see the options. So the first one is oxygen saturation, 84 on 2 liters of oxygen. So will you ask yourself now, is this urgent? Is it urgent that this client has COPD and then the oxygen saturation is 84? Do I need to intervene urgently? Then answer true or false. B, drowsy and difficulty to arouse. The client has become drowsy. We cannot arouse this client. Urgent intervention needed or not? C, barrel chest. If the client has barrel chest and we know that client has COPD, is this something I should run and solve? Clapping of the fingers. Is this something you should run? Will it kill my client right now? E, use of accessory muscles. So let's go. Let's write our answers in the chat box. Let's get this. All right. A, B, and E. A, B, and E are the correct answers. Oxygen saturation, 84%. Yes, it is less than 90. So this is dangerous. You must intervene. Your client is not drowsy. You have to intervene because of CO2 narcosis. So carbon dioxide is accumulating. Intervene. Barrel chest. This is chronic. It's not urgent. You should not choose that. Clubbing is as a result of the chronicity of the disease. Do not choose that. It's been there already. Accessory muscle. Yes, the client is in acute respiratory distress. They're trying to breathe in, get a lot of oxygen in, and they are using their accessory muscle. So you have to intervene. So A, B, and E. Okay. So do well to go through every option, treat it as an independent option, and then answer true or false. That helps you to ace your select all that apply questions. So let's look at this important question. Post-op complications. This is a key area you must master for the NCLEX. So, which findings 4 hours after abdominal surgery will require immediate action? Select all that apply. Findings after abdominal surgery. And look at the time, 4 hours. So these are the keywords, and then immediate action. Okay. So post-op complications require immediate action. So try and recall what kind of post-op complications are expected, which of them are not expected, and which of them do I have to intervene? So treat every option you're going to see as a separate option. So let's go. A, small amount of serosanguinous drainage. Isn't it expected? Heart rate 128. BP 8654. Absent bowel signs. Is it expected? It's just 4 hours after the surgery. D, restlessness and anxiety. And E, oxygen saturation 88%. Let's go. What are you going to go for? Let's see how safe you are. Let's see how safe you are. Let's go. Let's go. Let's go. Let me see your answers. Those on Facebook, drop your answer in the chat box. Let's give it a try. There's no harm in trying. Let's try. Let's all try. Let's finish up. Drop your answer. Okay. C, E, and B. So B, C, and E. B, the heart rate. C, and then E. Right, we got some of them correct. Yes, it's B, D, and E. Small drainage, yes, you got it. It's expected, so we're not going to run for that. Heart rate is so high, blood pressure is reducing. Our client may be in shock. We have to intervene. Right after an abdominal surgery, It's been 4 hours. So absent vowel sounds is expected. So if you do not have vowel sounds after some hours, so even the next day, and then you're not having vowel sounds, then we may be worried. But just 4 hours after an abdominal surgery, it is expected. So this question was testing that. Then restlessness, early hypoxia. So you have to sort out that for D. And then oxygen saturation of 88%. Yes, likely hypoxemia. So client may be in shock. And then there is altered mental status. So that you must intervene. So correct answers B, D, and E. Okay, absent vowel sound is expected. So that's why I have to watch out for the timing. We said 4 hours, and it's an abdominal surgery. They have tampered with the bowel. It will take some time for normal bowel peristalsis to resume. Okay, so that was what this question was testing. Well done. Yeah. So let's look at another high-yield question. You're finishing up soon. Neutropenic precautions. Neutropenic precautions. Neutropenic precautions, you can go sit for NCLEX and you have not mastered that. Okay, write it down and read it. Read neutropenic precautions. So we're going to go through it again. How we're going to sort out, select all that apply questions. You're going to look at every option, treat it separately. Look at your keywords. Ask yourself, what is this question asking of me? Do not create your own question. Only answer what you have been asked to answer. So, neutropenic precautions. Which intervention is appropriate? Private room. No fresh flowers or plants. Frequent hand hygiene. Encourage raw fruits or vegetables. Limit visitors with infection. So, content is key. You must know your content. What is neutropenic precautions all about? Especially you have a client who's on chemo and then the white blood cells are dropping. This client is prone to having infections. So we want to do everything to prevent this client from catching any serious infection. So that's when we institute the neutropenic precaution. So what are you going to do? Will you put the client in a private room? Will you not allow any fresh flowers or plants? Will there be frequent hand hygiene? Will you do that? So yes or no, treat each option separately. Private room, yes or no, you answer. No fresh flowers or plants, answer. And frequent hand hygiene, encourage raw fruits or vegetables. Will you encourage that? And then E, limit visitors with infection. So let's go. So the goal here is to prevent infection. So treat each option separately and then choose the option. Let me give you a chance to choose. So let me see your answers quickly. We are finishing up. I think we have one last question. I know that by the end of that question, you should get confidence with answering select all that apply. When we see select all that apply question, we should not freeze. We should be confident, go through it systematically, and then choose the correct answers. Okay. Are we trying this or I should help you? Okay, we got some response from darling. A, C, D, and E. A, C, D, and E. A, B, C, and E. A, B, C, and E. Private room, yes, you want to prevent infections. B, you must choose B because fresh flowers and plants, yeah, they can have some bacteria or fungi. We do not allow that. Always remember that for neutropenic precautions. Do not bring these clients flowers and plants all around the room. No. Hand hygiene, yes, that precaution is important. And then raw foods, no. Then limit sick visitors. This is a must. This is a must, okay? Because we want to prevent infection. So A, B, C, and E. So strict hygiene, protection from infection. So I think this is even a yes. The raw fruits, yeah. So I think the darling choose D. Yeah, you added the yes because we want to prevent infection. So no raw foods, okay? That is also part. That is part. That is part. Because raw food may carry bacteria. So we will not allow that. So no raw foods, no living plants. No, no, no. Okay, so strict isolation and then okay, yeah, you want to see the question one more time. You want to know what intervention will be appropriate. What intervention will be appropriate? So, okay, so appropriate. So that means that yes, raw food will not encourage it. So that's why it is a no. Okay, so we are not going to encourage raw foods. Is a no because of bacterial risk. A private room will help prevent infection. Fresh flowers, no, because they can carry bacteria or fungi. Frequent hand hygiene, yes, because we want to prevent infection. So this year, encourage, if you were to be, do not give raw fruits or vegetables. That one is yes, we add it up. But if it's encouraged, so always look out for the words. So the word encourage here, okay, and then limit visitors with infection. Your goal is to prevent infection. So A, B, C, and E. Encourage here takes this out. At first, I thought it was saying do not give raw fruits and vegetables. But encourage means no, 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 no. We can't do that. We want to prevent infection. So great. I hope you are good now. Awesome. Yes, yes, that's right. Yeah. Great, 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 great. So let's look at the last question. I hope we are mastering, we're getting confident. You're getting confident to select all that apply. When you see it, don't freeze, take your time and go through it one after the other. And look out for your keywords and only answer what you've been asked to answer. And do not be choosing options that are not needed. Choose only what is needed for your client. What will keep your client alive? So let's look at this. Is a psychiatric emergency is a must know. Which patient statement suggests immediate suicide risk? Steady suicide inside out. Select all that apply. So think about it. What are some of the statements that a client can make that will really cause you to think about this, that I think this client wants to kill him or herself. So you are looking for that client who has a plan, has a means, and is prepared to kill him or herself, and treat every option you're going to see separately. So for this question, that's why content is key. You have to remember SAT persons. This skill helps you to know which client has a high level of suicide risk. Okay, so SAT person is the acronym. S for the sex. So X for sex, so either male or female. So we have most of the time for the record, we have a lot of the females attempting the suicide. But for the success, we have male sex having a lot of success with the suicide because the female is kind of scared and will go for options that may not really kill her. But the male gender will go for the daring one and then you will be gone. So the sex is a factor, the age. Okay, so extremes of age, so whether less than 20 or over 44. Depression, if a client is depressed, high risk. P, previous attempt. If they've done it before, they can do it again, so watch out. E, excess alcohol or substance use. So if that client is abusing alcohol or is using substance, there's a high risk. R, they've lost their rational thinking, so they can do anything to themselves. S, we are looking at the acronym SAT persons. They lack social support. So the question is saying a 90-year-old pensioner, so she's old, she has no support system, maybe in the home has the support system, think of suicidal risk. Okay, organized plan. They tell you, I already have my weapon under my bed, watch out. No spouse, they are alone, watch out. sickness. They're dealing with chronic illness and they won't even end it all. So we add based on what your clients will have. When we add it up, it helps you to know who is at low risk from 0 to 4, medium risk, and then high risk for suicide, 7 to 10. Okay. So this question wants to know whether you know this, and then we're going to apply it. So let's look at the options. The option A, I've been giving my stuff away. So this client has started sharing his stuff. I feel tired of living. So will it suggest immediate suicide risk? So we are looking at the risk factors we looked at. I'm planning to use my dad's gun. Oh, they have the means, so it's part of the acronym we looked at. Sometimes I get sad, but I will be fine. If everyone will be better off without me. They are ready to go. So what will be your answer? Let's go. This is the last one. Let's choose the option and let's choose this. Let's choose this. I want you all to get it correct. So I'm sure that you are mastering select all that apply questions. Take it one by one. Ask yourself, is this a yes or a no? Is this a true or a false? Look out for the keywords. Immediate suicide risk. Immediate. So when you look at the question, go back. What is being asked? Immediate suicide risk. Immediate suicide risk. So let's go. Let me see some options. I want to be sure. Yes, and there is one more. A, C, and E. A, C, and E. When they give their belongings away, that means they are prepared, okay? So A is part of it. Tired of living, that is concerning, but the question is saying that immediate suicide. So if a person is tired of living, doesn't mean they're going to immediately kill themselves. It's a bit vague, okay? So we will not go for that, okay? And then planning to use they have a plan. They have a leader plan. That is, yes, we pick that. And then sad, but fine. That is also vague. So we will not go for B, we will not go for B. And E, better off without me. Yes, this is a strong indicator, okay? So suicide risk, they have a plan, they have the means, they are prepared, and they're always making statements that feel like they are a burden. So life is not worth living, okay? So that is why we go for A, C, and E. I feel tired of living, not too strong, okay? Because it says immediate suicide risk. Yes, they may plan it late, but I feel tired of living, not immediate, okay? And then sometimes I get sad, but I'll be fine. So I hope you got this, okay? Great. So how was today's session? Let me get your feedback. I always want to have your feedback to see how valuable the session was for you. Let me get your feedback. Have you mastered some confidence now for NCLEX